I would like to ask your permission to use this video for educational purpose and on internet.
Yes.
Thank you. Now, tell me about your symptoms, about your pain, about the sharp pain you had before the surgery.
My back was so bad that no matter what small little task I tried to perform, I was in excruciating pain. I was losing the strength in my legs, and I had been told that there was nothing they could do about it. But then I got word about Dr. Abbasi, and I went to see him, and he said, yes, I can help you. And yes, he did help me. He took away that horrible pain that I had been suffering with for years.
Where was that pain? Do you mind to show us where that pain was?
In the middle of my back.
In the middle of the chest,
between
actually.
in the chest area.
Yeah.
Yep, between my shoulder blades, and he got rid of that completely.
Now, your surgery wasn't even was a little bit even more complex because it was first of all in the chest, meaning that chest is generally a more complex area for the surgery in the spine. But as well, after your surgery, in about the 1/10 of the cases, I do need to put a drain in the chest to drain out any air that, because if you go through the chest wall, we poke a hole there and sometimes air remains there. Sometimes we have to get that air out. So I had to put a tube in. We call it a chest tube. You told me that chest tube was bothering you more than your spine, right?
That's exactly right. After surgery, I did not have very little pain from the surgery, but I had excruciating pain from the tube that had to be inserted in there, and that's all other than that, I have been doing just fine.
Yep. But still, how long did you stay in the hospital? The surgery was a Wednesday.
I went in and had it done Wednesday, and I stayed Thursday, went home Friday.
Well, even with that we have to put a chest tube in, you still went home 2 days after.
Yep.
In the open old-fashioned surgery, we literally open up the chest, collapse a lung, we put a much bigger tube in the chest, and people stay just 2, 3, 4 days in the ICU.
Yeah.
And then about a week or two in the hospital. But in your situation with the surgery we did, we could take the tube out next day and send you home 2 days after the surgery.
That's correct.
Now, here it is. This is what we did. We did a 2-level fusion in your chest area, and here's the side view. The bone is actually beautifully growing. And we put actually all that hardware, or those metal and so on, all minimal invasive with smaller incision, and people just recover much faster after that. Now, how are you now?
I'm doing great.
Okay.
Very good.
How was your life before the surgery?
Terrible. I lived in pain.
Yeah.
It got so, if I didn't take pain medication, I was in a lot of pain, and I did not want to have to live like that.
Okay. And when did that sharp pain in the chest go away? Right after the surgery, or did it take?
No, I actually struggled with that for probably a good month.
Yeah.
It was just so sore in there.
From the tube insertion?
From the tube area,
that insertion. But the sharp pain that you had in the back, that was gone?
Within a few days. I don't even recognize it since the surgery. Like I said, I didn't have pain in the surgery area.
Well, this is a good outcome, but we still have to give it more time to heal. We are 4 months after the surgery. So far I'm very happy with what I see. Bone is beautifully growing.
I'm glad to hear that.
And I think if you give it a little more time, it'll become even stronger. Okay?
That's good to hear.
Any other question or comment?
If there's people out there that are struggling like I was, I highly recommend getting in touch with Dr. Abbasi.
Thank you, I appreciate
He's a
that.
very good surgeon.
Thank you, I really appreciate that. Now, may I as well ask you, when you saw other surgeons to help you, what did they tell you? I mean, did they just tell you they cannot help you, or?
Yeah, they just said, there's nothing we can do. You got to live like this. That was my answer.
Did they have any other explanation why there's no option for you?
They didn't give me an explanation.
Most of the time, the answer for that is that the risk of doing surgery in the chest is so high that the solution is the risk versus benefit, especially if the surgeon doesn't have enough experience, that is not justified. So there are probably good surgeons that are just in their hand doing surgery was more risky than the possible help that they could provide to you.
Yeah.
So, and unfortunately, this is a chest is a very difficult area for surgery. So
Yeah.
in a way, they did you a favor not to do that surgery for you, because
Okay.
in the open old-fashioned surgery, that area can be very complicated surgery.
Well, that makes sense.
Okay. Well,
Yeah.
thank you very much for that
Well,
interview.
thank you for helping me.
Thank you.